Welcome everyone once again to This Week in Global Health. Today we are going to be talking about abortion as a global health issue, and we're going to tell you why it's actually a health issue. You may not think of it that way, but I've got a great team of panelists here to tell us all about it. And so before we get started on this very important and interesting issue, ladies, why don't you introduce yourselves?
Hello, my name is Vijoleta Gordeljevic. I'm joining in from Quito, Ecuador today, and it's also Ecuador that I will be talking about, giving you some insights about the reproductive rights situation over here.
I'm Marie Onakomaiya. I am reporting from Washington, D.C., and I will be talking about abortion as a reproductive rights issue.
Hi, and I'm Sarah Borg. I'm talking to you from Geneva, Switzerland, and today I will be talking to you about abortion as a health issue.
And I am Jessica Taaffe, and I'm in the Washington, D.C. metro area. And mostly I'm going to be just asking the ladies some questions about abortion as a global health issue and commenting in between. And I'm really excited to get forward on this issue. So the reason why we picked this issue, I'm sure people have been hearing about Zika in the news and how there's this association with microcephaly, and that's the babies being born with small heads. And a lot of people are really scared about this and trying to think about what's going to happen if they had a Zika infection during pregnancy. Will their child be come out with a small head and have this potentially very deforming condition later in life, and what they can do about it? So it brings up a lot of questions about family planning, contraceptive access, safe and legal abortions for those people that may consider that as an option, or maybe they may not have that option. And in fact, in a lot of these Latin American countries, it's been recommended for women to avoid pregnancy due to the presumed prenatal consequences of Zika virus, like microcephaly. And because of this, rates of abortion are predicted to rise. And this is a problem because in many of these countries, there's a lack of sexual education in schools, limited contraceptive access, and abortion is illegal in a lot of these places. So when abortion is illegal, then you get these things like unsafe abortion, and unsafe abortion can lead to health issues. It's a very important issue that's going on in the news right now, and a lot of people are talking about it. So we wanted to cover it, and not necessarily just about in relevance to the Zika outbreak going on, but just in general, because this goes really beyond the connected to Zika right now. So let's get into it. Sarah, tell us why abortion is a public health issue.
Thanks, Jess. Just before I go into that, I just wanted to push the point home that Zika has not actually yet been a proven cause of microcephaly, and it's just an assumed cause. And it is a very likely cause, but there still needs to be further studies to prove causality. As for why is abortion a public health issue, well, when women lack access to safe abortion, they can often make the decision to undergo an unsafe abortion, which can result in complications and sometimes even death. So roughly 40% of pregnancies worldwide are unintended, and approximately 50% of these end in abortion. Now, in 2008, 6 million abortions were performed in developed countries and 38 million in developing countries. And it's important to note that not all of these abortions are safe. So approximately 56% of abortions worldwide are unsafe, so just over half, which means that the procedure is done by a person who's lacking the necessary skills, or it's done in an environment which lacks the minimal medical standards. 10 to 50% of women who undergo safe abortions suffer complications requiring medical care, and overall unsafe abortions result in the death of 47,000 women per year worldwide, which is 13% of maternal deaths worldwide.
Sarah, thanks for those statistics. To me, it's really eye-opening to hear those numbers. And it really puts into perspective the morbidity and the mortality that's associated with unsafe abortions around the world, and why it's a global health issue. Now, I think what's also interesting is to compare the risk of complications in legal and safe abortion to those from unsafe abortion. And for instance, in the US, there's less than a 0.05% risk of complications that require medical care and deaths are really low as well. So in fact, it's actually there's 11 times more deaths in the US associated with giving birth than legal abortions, which means basically that giving birth is medically more risky than abortion. So Sarah, how do we go about addressing this issue of mortality from unsafe abortions?
Well, just the ultimate goal really is for no woman to have the need for abortion, i.e. to avoid all unintended pregnancies. Tactics of advising abstinence have long been well proven to be ineffective and sometimes dangerous. Evidence has shown us that making abortion illegal is not the solution either. And it doesn't stop women from having abortions, and in fact, usually they then resort to unsafe abortions. If we want to prevent unsafe abortions, couples need to be provided with effective, comprehensive, accessible, appropriate, and affordable family planning and sexual and reproductive health education.
Sarah, can you maybe tell us a bit about whether there's any evidence that family planning affects abortion rates and maternal deaths?
Yeah, so it definitely does. It has been demonstrated historically in various countries that when modern contraceptive methods become available and their use increases, abortion rates decline. So if women who were not using contraception but wanted to delay pregnancy were provided with effective contraception, 30% of maternal deaths could be avoided worldwide.
Right. So this issue goes beyond the obvious health issues. As we know, there's a lot of other disciplines and sectors that factor into global health. Here, reproductive rights and the legality of abortion heavily influences health issues that are associated with abortion. So let's talk a little bit about this. Marie, can you tell us a little bit about abortion as a reproductive rights issue?
Absolutely. A woman's right to choose continues to vary around the world. And in the 199 independently governed nations and territories in the world, abortion laws fall into four main categories, ranging from illegal under every circumstance to legal without exception. So just to break it down a little bit by country, abortion is illegal in 66 countries, though over half of them provide explicit exceptions for imminent maternal mortality. Only 6 countries prohibit abortion without exception, and 4 of these are actually in Latin America. There are 59 countries that go a step further and permit abortions to preserve the mother's health. 21 of these countries even include mental health exceptions, for example, Northern Ireland and Peru. In 13 countries, they go even an additional step further and include socioeconomic exceptions. And this examples of countries like that are the UK and Japan. And then the final group, the fourth group, where abortion is legal without restriction, that's about 61 countries, such as the US and Tunisia. However, in many countries, abortion laws continue to be tenuous. A few examples, a 2015 case in Paraguay, where a country which has explicit maternal mortality exceptions, a judge refused to allow an abortion for a 10-year-old girl who was raped by her stepfather. And in the US, where abortion is legal, changing state legislation continues to threaten the accessibility of abortion. And actually, on a recent episode of John Oliver's Last Week Tonight, where he discussed abortion laws in the US, he showed examples of how abortion has become practically impossible for many Americans. And he made a pretty profound statement where he said, abortions cannot just be theoretically legal, beg your pardon. It has to be literally accessible.
That's really interesting hearing all the different the variations in legality around the world about abortion, and even it's not just about legality, it's about the accessibility. But let's get back to the legality and penalization of abortion. So to what level do countries enforce penalties on abortions?
This varies widely, actually. One example of pretty draconian penalties is in El Salvador, which is one of the 6 that prohibits abortion without exception. And here, authorities actively investigate and prosecute women if their pregnancies terminate before 40 weeks. And people are sentenced up to 40 years in prison. And why this is particularly problematic is that some of these terminations could be the result of a natural miscarriage, preterm labor, or even stillbirths. So you have many reports of women who are still sent to prison even though they never actually broke these laws. Another example is in Chile, where anyone convicted for performing an abortion can be punished with up to 3 years in prison. So both the women who need these abortions and the providers who provide them can be at risk depending on where they are.
Marie, how does current access to contraceptives affect the current rates of abortion?
That's a good question. And actually, according to some data from the World Health Organization, abortion rates continue to be comparable between nations where abortion is legal and those where it's not because of limited access to effective contraception in those countries. So there seems to be this overlap between countries that don't allow abortion that also do not provide effective contraception. Either it's not accessible, or the government, or for religious reasons, it's not an acceptable form of family planning.
Right. That's really unfortunate for a lot of those places that, you're lacking access to contraceptives, and then you don't really have the options for an abortion. You can't prevent, unwanted pregnancy, and then you're stuck with it afterward. That's quite a predicament, I imagine, for some people. And but Vio, I know that you are in Ecuador right now, and you're working with organizations on this issue. I would love to hear a little bit of your experience on the ground.
Yeah, so I'm in Ecuador since about 2 months now, and I've been very lucky to speak to multiple organizations and individuals fighting for reproductive rights here. The Penal Code of Ecuador prohibits abortion except in the case of a threat to the life of the woman, or when the pregnancy is the result of rape of a mentally disabled woman, so only then. Otherwise, under current law, any medical professional performing the abortion can face up to 5 years of jail, and the woman herself can be sentenced to times between 1 to 5 years. On paper, the most recent revision to Ecuador's constitution included explicit reproductive freedoms, such as the right to decide when and how many children to bear. However, access to those contraceptives is usually very, very low in many parts of the country, and access to safe and legal abortion is basically non-existent, which is why every year up to 30,000 women end up in hospitals with complications from badly performed abortions here.
Wow, that's unfortunate to hear. That's a lot of complications due to unsafe abortions. Now, Vio, you say on paper. What do you mean by that? Is the government not really supportive in practice?
You can say so. The paradox in Ecuador is that the government, which claims to be progressive, has an unusually strict stance on abortion. Its president was expressing that he will never legalize it, which is why many activists on the ground that I spoke to, they told me that they decided to focus less on changing the legal landscape, as they simply don't expect any big change to happen there while the government is still in place, and to fight more for depenalizing abortion socially, as they say. This means they want to help, end the stigma, open communication nationwide, making it easier for women to talk to each other about what's happening, but also to approach doctors and ask for help and get more information on contraceptives. So that's the current focus that most activists here on the ground have been adapting.
Vio, what does the activist work look like in practice? I know you mentioned a couple of those things, but how do they help women in need of reproductive services or advice?
Yeah, there's a lot going on. There's a lot going on behind the curtains, as you can imagine, that being an advocate for abortion rights in a country where even medical personnel is being penalized is really no easy job. The work that these women, mainly young women, in fact, do is, on the one hand, providing information on contraceptives. So they provide this information through reports on their websites, but they're also very, very active on social media, where many young girls, of course, get exposed to this information. There's also a lot of activism on the streets. There's a big march coming up here in Quito in a few weeks, But there's also one thing that has been working very well lately, which is basically a service help hotline that an organization called Salud Mujeres has initiated, where they basically answer to phone calls from women who want to obtain information about medication for safe abortion at an early state of pregnancy. So volunteers running that helpline offer tips to these women on how to find these pills, where to get them, how to go about it. And sometimes that advice even includes having to lie to a doctor about having actually another condition for which then the same pill can be prescribed legally. So you can imagine the fight here is really difficult, and we got a highly religious country. We got many unplanned pregnancies, a government that claims to be supportive of reproductive rights, but clearly fails to do so in practice, and a movement that it is growing, but that is still not yet strong enough to really address this important public health issue. So it is to be seen.
Thanks, Vio. That must be fascinating and so eye-opening to be on the ground and really see these issues, in person just play out and see how it affects everyone's lives and their health and the choices that they make, especially for women. I'm sure all of us here can be very empathetic to a lot of these issues. So I just want to thank everybody for talking today and giving us your insight and providing stats on this issue. It's obviously very important and very timely that with everything going on with Zika, I think it's brought to the front this issue of abortion as a global health issue and something that cannot be ignored. So I just want to say thanks again, and hopefully you guys tune in again. You can find us on our webpage, This Week in Global Health. twigh.org. Also follow us on Twitter and Instagram, and check back with us later on our YouTube channel, This Week in Global Health, for more shows in the future. So see you later. Bye.